we're forming cancer cells. I'm forming cancer cells right now, but my immune system recognizes these mutated cells are forming and they go and take care of it before it causes any problem. But if your immune system is suppressed, like with these immunosuppressive medications, your immune system is not going to be able to catch that cancer that's growing rampant, and it's not going to have all the army it needs to be able to take care of it.
You're watching the Dr. Jake podcast. Welcome back, Health Nut, and I'm a wife to a cancer fighter, and I'm here with Dr. Jake on a very special topic to me, the top 6 causes of cancer that he sees in his Dr. Jake.
So I'm going to enjoy this topic because now I do like helping patients that already do have cancer, but I would like to be able to prevent them from ever having to come to me and have to be treated for cancer. So today we're going to talk about the causes and what we can do to help prevent maybe getting cancer in the future.
I love it. And you've got a lot of integrative elements that you bring in, but you are also specifically a naturopathic oncologist. Like one of the things that you would call yourself? How does that work with oncology?
So a naturopathic oncologist or integrative oncologist is someone that has an understanding of the conventional therapeutics, but also has an understanding of what type of herbs, nutrients, diet, and other therapies that work in unison with those therapies or other therapies that can be used besides chemotherapy, radiation, and surgery. We can work in unison with your oncologist if they're willing, or we can give suggestions when you're getting chemo, or if you're like, I don't really want to do this path, I've read a lot about it, it's not really the path I want to go, we could give you suggestions of the most research regarding that. So that's in a nutshell what a naturopathic oncologist is.
And I know we were very excited to have found you when we were on our journey because there's not a ton of you out there. And as a matter of fact, I think you're like pretty much, I mean, from what I understand, like the only one, I think in northern Utah. We're very blessed to be able to have, this episode that I'm able to, interview you on and just really learn what we can do to try to prevent it by knowing what some of these common causes are. All right, so let's move forward and get started on learning these top, 6 causes of cancer that we see. But first, we want to remind our audience that this is just a podcast, right, Dr. Jake?
Yeah, so this is just a podcast. I'm not going to be giving any specific treatment advice. So if you have any questions, concerns, or if you have any family dealing with cancer or other medical conditions, give my office a call by visiting our website, integrativemedica.com. You can set up a video visit or an in-person visit with me or some other great doctors that I have on my staff.
Wonderful. Now, before we get started, what is new with you? We haven't been seeing you on Thursdays in the office lately. What's going on?
So I've been able to hire some really awesome doctors, so I'm not going to have to be in the office all the time. I'm still able to see as many patients as I was, but I'm able to consolidate things and have my other doctors do things for me that I don't absolutely have to do because they're awesome at doing that. So I am able to spend more time in other health-related endeavors. So right now I'm working on getting my a product ready called TerraBrew, which is a product I'm really excited about. It's a product that gives you good energy, but it's healthy. So I have a lot of patients that come into me that are really tired and fatigued, and they're taking all these energy drinks and they're taking caffeine pills or they're pounding the coffee. And that's just making their condition worse and worse and worse. So I've been really thinking for a while, what type of product can I put together that is just going to help them feel better, but also give them that little energy boost that they need and give them all the nutrition that they need in the morning too. So that's what TerraBrew is. It's going to give you energy, mental clarity, more focus, concentration for the morning, and also help your body work better and decrease inflammation, help with your gut health, etc. So I'm really excited to get this going and be able to put this out to the people so they can be able to get it and be healthy.
Now, I know we did talk about that TerraBrew a bit more in one of our past episodes, the one specifically on the benefits, I think, of mushrooms for overall health, because there's some mushrooms that you do put in this TerraBrew. So if you guys are interested in learning more about TerraBrew or about mushrooms, make sure to check out that episode. I'm sure I know one of the protocols that we're taking with my husband for cancer also involves mushrooms. So it applies even to this particular episode where we're looking at the top 6 causes of cancer. If you have cancer or you know someone who does, if you're a caregiver, let us know in the comments. Let us know what kind of cancer you're dealing with, if you're a caregiver or if you are fighting it yourself. We want to know more about you. Okay. That'll also help us know what other episodes we can in the future, better meet your needs and help your journey. Let's get started, Dr. Jake, on some of the big causes of cancer that you see. The first one that you gave me was chemical exposure. Can you talk more about what this looks like in all of the ways?
Yeah, so chemicals exposure. So this is a big topic. So there's a lot of different chemicals, and a lot of them have potential cancer-causing effects. So first, I would like to start with herbicides and pesticides. So this has to do with foods that we're eating, but also has to do for things that we're spraying on our food or spraying on our plants or keeping our yard pretty. These are all things that could potentially cause cancer. If you look into the research, a lot of the constituents that they're using can cause lymphomas or prostate cancers or other blood related cancers or breast cancers, on and on and on. You can look into the research that and most of the research that they've done in detail to make it ethical is on animals. But we are seeing in a lot of way down the road, 30 years after using a product, that we're seeing a great increase of people that use this product of having this form of cancer. And that's why you're seeing new lawsuits coming out for like Roundup, for the glyphosate exposure, and many other herbicides and pesticides because of the effect they have on the body. So these can cause mutations of your cells, and mutations of your cells is what leads to the cancer growing. A mutation of cell makes it not work how it's supposed to, so it exponentially grows, and that's what cancer is. And that's what these herbicides and pesticides do. So we also have what I call is cosmetic products that we can put on our skin, our lips, or whatever we use cosmetics for. So and what these have a lot in them is called xenoestrogens. So these are constituents that act like estrogen in the body. So if you're putting all this estrogen on your body, you have your own estrogen, and then you're putting more estrogen on top of it. So you're getting way too much estrogen, which makes you estrogen dominant, which then can lead to a lot of girl-like symptoms that can lead to more like PMS, irregulation of their cycles, more cramping, depression, anxiety, etc. But this also increases our risk of breast cancer, ovarian cancer, and uterine cancer, and other cancers that are related to high estrogen levels. Plus, having just high estrogen levels is very inflammatory, which is a big problem with cancer also.
Now, question for you: for the men who are watching this, who are they're manscaping, they're taking care of their skin, they're doing that kind of stuff, they're
Yep.
putting on some of these products. Is this something that they need to be concerned about as well?
Definitely. So if there's a lot of men that are putting a lot of lotions or gels, or they're putting makeup on or whatever like that, they're same thing. Those have the xenoestrogens in them too, but that's going to make you have more estrogen in your body, which prostate cancer, we like to think, oh, it's caused by too much testosterone. No, it's caused by too much testosterone and estrogen, and too big of an imbalance of your estrogen and testosterone pathways. So, and again, too much estrogen leads to inflammation, and that can cause dysregulation of your cells and lead to cancer too. So, yes, it's both for men and women if you're putting a lot of chemicals on your body for cosmetic reasons.
So before we move on to some of the other things that you have on this chemical list, going back to fertilizers and sprays, we want to have a pretty yard. We don't want to be using Roundup and some of these other types of pesticides that could be causing cancer for us. Are there other like natural ways that we can be making sure that we have a pretty yard without affecting our ability to, influencing our ability to get cancer from it?
These chemicals are created for a reason because they work really, really well. Do we have things that do work well, like that can help prevent certain bugs to get on your plants? We sure do. Like there's this orange spray. I'm forgetting the exact name of it, but they love to use this in Disney World and Disneyland, and it has a little citrus smell to it, and it's non-toxic and it's very healthy and it works really well. So that's a really great product that can be used too. Vinegar can be worked well to help kill off your weeds, but then old-fashioned pulling your weeds is probably the best way out of them all to really get it taken care of. But here's some things you could do too. Is let's say you're using Roundup or whatever, you can cover yourself with a mask and make sure it has no exposure to you. But if you're outside spraying it, without any type of mask on or any covering on your skin. You're getting it on your body and you're going to be exposed. But if you cover yourself up and use these products, it's okay, as long as you don't go barefoot outside and run around into your lawn within like probably 3 or 4 days after using it. But I would prefer not to use it at all. My lawn looks pretty good, and I don't use any of these products. I just go out there and take care of the dandelions early, and make sure things look good that way, and be consistent on pulling the weeds. But so I don't use those chemicals, but those are some ways that you can use them and not maybe cause cancer for yourself.
And I also think about our children, right? Like we're spraying our yards with Roundup, it looks really pretty, and then we let our kids go out and play maybe the next day or the day after, and they're running around
Yeah.
barefoot. And what are we
Hmm.
possibly doing for them? So, I remember learning from my mom growing up. It was like, the ugly apples at the grocery store are the ones you want to eat, not the pretty ones. So maybe, we can also just kind of change our perspective on this aesthetic idea of
Yep.
of beauty all the time. And as far as the makeup ingredients, we were talking before. There's a website called EWG, and they have an app actually as well. So if you use a phone and that's your primary way of searching, you can get the app. You can also go to their website, and they have a database where you can look up. Makeup, lotions, shampoos, all sorts of things that you use for your beauty and your skin, and be able to actually find out a score on how dangerous some of the ingredients are. And you can actually find products that are very clean without any of these estrogenic ingredients that Dr. Jake is talking about. And I know I was looking at one of them when you and I, Dr. Jake, were talking, and you were suggesting mineral makeup. And
Mhm.
I found a number of really great quality mineral based makeup products on that website. So I encourage you guys to check it out. We'll put a link in the description box so that you can take a look at it as well. Let us know in the comments, which ones stood out to you. If you took a look at it, are there any ones that you're planning on buying because of, this particular part of this episode? Let us know. We want to know what you're doing in your journey. Okay, next one, or the next type of chemical exposure. So you talked about fertilizers and, pesticides and things like that. We talked
Mhm.
about the ingredients in our makeup. Can you dig in a little bit more into what you were talking about with the chemicals that are coming into our food, specifically our
So,
vegetables and our fruits, right?
so we have the fertilizers, the herbicides, we have those things, but we have certain solvents that could be put on our food. But really, these are things that we get from just working in our daily lives. Let's say, like using a credit card machine, and then we have that printout of uh,
The
the ink,
receipt.
the
Mm.
receipt, and then you touch that, and that has a chemical film, and that can cause cancer too. So you want to be careful there because it is a solvent; it's going to be absorbed. We have benzene, which is all over the place from a lot of different products that we can breathe in, especially if you're in like the plumbing industry or you're in the welding industry, you're going to get a lot of exposure there. So just be cognizant that if you're using a certain chemical and you don't know if it's a natural product, it might have potential to cause cancer, because when we start studying these things and these foreign substances get in our body and cause disruption, we find these things out. And unfortunately, we think our FDA is blocking all this stuff to keep us safe, but they're not. They find out that these things are unsafe about 20 or 30 years later, and they might put a warning label on it. Like glyphosate's getting well known to cause lymphomas, but it is still on the market, right? We're not safe in that regard. So there's just all these solvents and things. So try to just use the cleanest products you can. Try to stay away from these chemicals. And if you can't, please use a mask. I know when I was a young guy, I thought I was way cool not using a mask. And I feel like a real idiot now for some of the things that I could have been breathing into my when I was working in construction. So wearing the mask to help prevent all these things can be really good to help with that.
I like what you're just saying. Like what you're really pointing out, I think, is like as biological, beings, we have there's so many ways of chemicals to get into our body. Yes, we could ingest it through our mouth, but our skin absorbs chemicals. It goes right into our bloodstream through those, those little veins that we have, right? And then even what we breathe, I mean, that's going straight into our lungs, which then again go right into our bloodstream as well. So we need to remember, I think, that we have numerous ways that we are bringing in chemicals into our body, and so to be considering our skin, our eating, what we're breathing in. So moving on, talking, I think we want to talk a little bit about, our organic versus
Yeah. Mhm.
non-organic fruits and
Yeah,
vegetables.
so there's organic and non-organic type of fruits and vegetables. but you don't have to get all foods organic. There's some foods that really don't get a lot of pesticides and herbicides on them, even though they do come organic, like avocados. You really don't need to get these organic, or green peas or mini melons. You don't have to get that way. And EWG, Environmental Working Group, makes it really easy for you because they do the research every year of what foods have the most pesticides and which foods don't have any pesticides on. So for people that are living on a budget, I say the dirty dozen, you definitely want to stay away from. Don't worry about the clean 15. And then everything in the middle, if you really can't afford it, you can eat these type of foods. But if you can afford it, usually what I do, try to get everything organic you can except for the clean 15 foods. And that would be the best to help prevent cancer and many other health issues.
So make sure and look that up. You can Google it and you'll be able to find all sorts of resources out there to really list out what that dirty dozen is and that clean 15 so that you can make some better choices when you're at the grocery store. Thank you so much for that. Okay, so the next thing that you had on our list is being overweight and living a sedentary lifestyle. So I'd love to hear more about how this actually plays a role in cancer. To me, I would think, oh, that has to do with just more of like diabetes or, you know,
Mhm.
heart problems. Can you expand on that?
So what we're seeing in the research is people that are overweight or obese have a much greater chance of getting cancer than people that are in a more normal weight category. There's many reasons for that. I mean, when you're more overweight, you're going to usually, in many instances, have more inflammation in your body because the more fat we have in our body, the more inflammatory cytokines that we have floating around in our body. The higher your cholesterol is, like your LDL cholesterol, that increases C-reactive protein, that increases inflammation, which causes disruption with our cells and can lead to cancer. Having the high blood sugar content that usually goes along with, you don't have to have diabetes when you are overweight, but you're at risk of that. And having even not diabetes, but let's say you're pre-diabetic or you have a high blood sugar level, that can lead to that level. The big thing is when you're overweight, you can have inflammatory cytokines around your cells because you have these inflammatory fatty acids around your cells, which make it more inflammatory. So if you're overweight, that's what can cause this cancer risk. No one absolutely has a specific, yeah, this is the reason why overweight people have cancer. But I'm looking at all the other causes of cancer and what people that overweight or obese usually have in their blood work and why this is the reason for it. But when we look at the being overweight and obese, you have a greater risk there. And we're also seeing people that are more active that do aerobic exercise over 3 times a week and actually are building their muscle mass, that they are at less risk of getting cancer too. So trying to keep your weight under control, try to be a higher muscle content compared to fat content is a big help for preventing cancer.
Now, I like what you had mentioned here about it. Like, it has to do with increasing your risk, right? There's no like necessarily one thing in this list. It's like, if you do this, you're going to get cancer, right? It typically,
Mm-hmm.
what we're learning about cancer is it's oftentimes a perfect storm, a couple of things that you've been exposed to, that you've experienced, that you're going through that when combined together, turn that switch on in you. With that, take all of what we're talking about today, factor it all in, really take a look and think about, where is my risk then at this point, if with how many things we discussed today that I'm being exposed to, and then start, working on changing your lifestyle. So, I imagine as well then that while these factors can actually prevent cancer if you're addressing them now before actually getting cancer, you could also probably fight cancer better by also addressing these if you currently have it. Am I right,
Yeah,
Dr.
so
J?
everything we're going to be talking about is preventative. And also, this is what I recommend to my patients that do have cancer. So, yeah, very important. And
All
what's
right.
interesting is going into this is if you go to your conventional oncologist and let's say you are overweight, they many times are going to say, you do not want to diet at all. You want to keep as much weight as you can on your body because if you lose weight, it's bad. And I'm not that way at all. It depends where you're at. Now, if you are really skinny and you're very frail and you don't have a good vitality, yeah, you don't need to lose any weight if you do have cancer. But if you are overweight and you have a big fat to muscle ratio difference there, I'm going to say, yeah, we need to work on maybe decreasing some of the poundage because what is, and I don't want to say pounds, fat is what we want to decrease
Right,
because
right.
that's the inflammatory stuff. So I just want to make that point there is I'm not anti-diet when people have cancer.
I know when my husband had cancer the first time, He was told by his conventional oncologist to like just load up on the calories, eat lots of
Mhm.
chicken. That was that was the
Yeah.
advice. Eat lots of chicken, and so forth, and try to gain a bunch of weight. And he was told that diet has just nothing to do with it, and absolutely nothing to do with it. And it's
Mhm.
just interesting now that we're coming to really see. And I know you're going to be talking about diet here, you know,
Mhm.
in a minute. But for first, we want to bring up another one, and and you kind of already touched on it a little bit when it came to being overweight, how it can influence your inflammation. But just dealing with chronic inflammation of any kind for whatever cause, and we see this a lot in autoimmune conditions. And if you're being treated conventionally, that there's some risk here with that. So can you talk a little bit about chronic inflammation, autoimmune conditions that are treated conventionally, and how this is possibly putting them at risk for cancer?
I've been talking about this a lot because really the root cause of a lot of cancer, a big piece is the inflammatory component. But let's say you do have chronic inflammatory disease that you know about. Let's say you have an autoimmune condition like rheumatoid arthritis or multiple sclerosis or lupus, etc. And let's say you are treating it conventionally, then you're going to be immunosuppressed. But let's say you are treating the lupus or rheumatoid arthritis without taking a conventional medication that's suppressing your immune system. Are you going to be at risk? Yes and no. Let's say you're not doing anything about your inflammatory condition and your inflammation is just going rampant. That can increase your risk of cancer because both these diseases, autoimmune diseases and cancer, are disruptions of the immune system. So you're going to be at greater risk if you have autoimmune disease if you're not taking care of it. But let's say you're taking care of it with your diet or certain herbs or other things that you're doing that is keeping your numbers at bay and keeping your symptoms at bay and your inflammation is under control. You're not going to be at greater risk of getting cancer at that point. So it's mattered how you're managing it. But if you're taking like Humira or methotrexate, which are very common immune suppressive medications that patients take for autoimmune disease, this is going to suppress your immune system. And if you suppress your immune system, your risk of cancer greatly increases because that's what prevents cancer cells from going rampant throughout your body. So every day we're forming cancer cells. I'm forming cancer cells right now, but my immune system recognizes these mutated cells are forming and they go and take care of it before it causes any problem. But if your immune system is suppressed, like with these immunosuppressive medications, your immune system is not going to be able to catch that cancer that's growing rampant, and it's not going to have all the army it needs to be able to take care of it.
Interesting. Very interesting. Thank you for that. Okay, so moving then on to the topic of diet. There's a list that you've given me. And I know that part of your treatment is when you're working with patients with cancer is to definitely work on diet. Like that's a very common like
Hmm.
part of the practice. Like we need a fixed diet.
For
What
sure.
are some common things that people are eating that could be contributing to their body's ability to make cancer? I imagine that is it the diet that's making the cancer or feeding the cancer that's already in us that we're not able to fight because of what you were just talking about? What are these foods?
So a lot of people are going to hate me right now. So I'm going to talk about a lot of foods that people are probably loving and they're probably the favorite foods they eat. So I'm going to start with refined sugars, that white stuff in the cupboard, high fructose corn syrup, that type of stuff. So why do we want to stay away from that? Is because it's very pro-inflammatory. It increases our sympathetic nervous system. That puts us in fight or flight mode, and that increases the inflammatory cytokines that roam around in our body. Also, increased blood sugar in our body releases insulin, which is pro-inflammatory and pro-growth. So if you eat these foods, you're going to increase this inflammation, but also you're going to increase growth. Whenever you increase certain growth, you might get bigger muscles, but guess what? You might be increasing the growth of your cancer too when you're doing that. Also increases insulin growth factor, which then is pro-inflammatory and can cause cancer. So these are all many reasons why we want to reduce the refined sugar intake. Plus, cancer loves sugar. That's what it feeds on. That's the main source of its fuel. So if you're eating tons of sugar, you're flooding those cancer cells and giving all the fuel they need. Let's say we're doing this preventative. Let's say you have all these cancer cells always forming every day, but you're eating tons of sugar. You're giving them more potential to outwit our immune system and grow faster than our immune system is able to take care of it when we keep on flooding them with a ton of fuel, so to speak, when we're eating all this sugar. So refined sugar is a very beginning point I would do if you really want to prevent cancer. If you have a risk for cancer, you really want to limit refined sugar in your diet. Yes, and then I want to dive into fatty acids.
Okay.
I'm a fan of good fats, and then there's bad fats. We like to talk about avocados, so I'm the good fat type of thing. And yeah, avocados are good, but then we do have bad fats like saturated fats. And guess where saturated fats come from? Mostly from animal products. Now, there are saturated fats that do come plants, which are short chain fatty acids or medium chain fatty acids that are triglycerides, which are found from plants. And the research on those is inconclusive. But if you do look at islanders, which we're eating mostly saturated fats from coconut oil and palm oil, their cancer rates were really low before they started introducing their current diets they have that are a lot of processed foods, etc. So I don't limit saturated fats in my cancer patients with coconut oil, etc. But I do with saturated fats that come from animal products because the research is clear that the more saturated fat you eat, the more potential you're going to get cancer. Just like it's have increased risk of cardiovascular disease too. It depends on what type of fat you're eating and also the quality of that saturated fat you're eating too. If we want to prevent cancer, I tell my patients to limit animal products in their diet. And if anything, you want to get a clean meat. You want to make sure you get grass-fed beef because fatty acids are different. If you are going to eat eggs, you want to make sure they're pasture raised. But we're going to talk about eggs in a little bit too. Is eggs in the research, which was really disappointing to me when I found this out. It's pretty clear that if you eat a ton of eggs, your risk of getting cancer increases. And I think this is mostly coming because of all the saturated fat in the yolk and likely not coming from the egg white. So you probably can have egg whites and not egg yolk, but the research isn't conclusive on that and hasn't gone into that. So I recommend my patients not have a lot of eggs if you want to prevent cancer. Maybe have it 2, maybe 3 times a week and not eat a ton of eggs.
You know, that part when we were talking about it really hurt me. And the reason why is because here I am, I'm trying to get off refined sugar. I'm staying away from, cereal in the morning or a big old fruit smoothie that's just going to jack my sugar levels up earlier in the day. And, trying to eat this more of like a higher health, higher fat, higher protein type of breakfast. I feel better, when I do that in the morning. So I eat eggs every day. So now that I'm hearing this from you, it's like, okay, what can I change? Okay, I can switch down to eggs, 1 or 2 times a week. What are some possible alternatives if we want to stay away from cereals, these high sugar breakfasts that are so common, and are still be able to have a good, fatty, protein based breakfast that's not going to trigger, cancer cell growth?
So let's start here. So I don't want people to think, okay, eggs cause cancer. You did talk about refined sugar.
Risk, right?
Eggs can risk your cancer. It's not going to absolutely cause cancer. Yeah, thank you for that. So let's say you start eating tons of sugar in the morning now. I think that's a lot worse than actually eating eggs. So if I had to compare eggs to sugar, please limit the sugar. But I'm just putting it out there that if we eat a lot of eggs, it can increase it cancer risk. So let's talk about some things that we could do instead. Eggs, if you are going to eat eggs, I would get omega-3 fatty acid eggs because that is going to get you more of the omega-3 fatty acids, which can help prevent cancer risks. And it's going to be more anti-inflammatory when we do that, but it's still going to have that saturated fat. So you don't still want to eat a lot of that. Like I said before, you can maybe eat more of the egg white compared to the egg yolk because likely what we're seeing is because of the saturated fat content. Because the diets that are really high in saturated fat, we're seeing that is increasing our cancer risk when it's high in that. But we could also start eating a lot more nuts and seeds in the morning, and we could change our mindset of what breakfast is. Here in the United States, we have a thought of breakfast, and it's many times sugary foods with eggs and bacon. That's usually what we think about when we think breakfast, or we think oatmeal. I like oatmeal if it's done right. So if you eat a good quality oatmeal that's organic, non-glyphosate, and you pound it with a lot of nuts and seeds and blueberries in there, it's like a 1-to-1 ratio of nuts to oatmeal. And then you can add some good quality fats in there, like a little bit of coconut oil. I think that is a great alternative to eggs in the morning. You could also do smoothies. Don't eat tons of sugar again. You don't want to just put a ton of refined sugar in there or put a lot of fruit in there, like tons of bananas or things like that. But you could put berries in there and then a lot of spinach and celery and whatever you like to put in your smoothie. That's a great alternative there too. But there's all kinds of options. Or you could just start eating a lot of things that you eat for dinner and for lunch, for breakfast. And that really is a healthier way to go about it. Kind of switch your mindset. What is breakfast? It's not necessarily what we've always been eating. And it can be, and once you switch that, you start eating more healthy in the morning.
I love it. I love just changing the whole narrative. Okay, so we have more. The one impactful for me at the end, but there's a big one here that I know our culture just has a lot of beliefs about, and that's genes. Can you talk a little bit about how genes can affect cancer and what's true and what's not, right?
So with genes, a lot of people think cancer, okay, it's genetic. My mom had breast cancer, so I'm absolutely going to get breast cancer. It's just nothing I can really do about it. My mom had ovarian cancer, I'm going to get that. My dad had prostate cancer, I'm going to get that. And this isn't absolutely true. So yeah, you are probably at increased risk because your mom had breast cancer, but there are so many changes that you can make in your life to, that means that you don't absolutely have to get breast cancer. But there are cancers that are definitely increase your risks, but I wouldn't say you're absolutely going to get cancer because of this specific gene that you have or the parents that you have or anything like that. Like let's say there's the BRCA1 and 2 gene in breast cancer. Yeah, that does increase your risk, but that doesn't absolutely mean you're going to get cancer. Some people think, okay, I have these genes, I'm going to get breast cancer, so there's nothing I could do about it. If you do have these genes, what you do say is, okay, I'm at risk, and you need to listen to a lot of the things that we just barely talked about, decreasing your sugar intake, maybe exercising more, getting your weight under control, eating differently, eating less saturated fats, eating less animal products, these type of things, and you're very likely not going to get breast cancer in the future if you change your lifestyle up. That's what I want to put in genes. If you talk to other doctors, they always say it's all genetic. There's nothing you can do. And that's so far from the truth. They say that about so many different medical conditions. And I like to tell my patients that's not absolutely true. We can change our genetics. And we're seeing that in the research that people that eat a certain way and change their lifestyles are having completely different DNA than the parents.
So I really want our audience to understand and hear from Dr. Jake. Yes, genes can put you more at risk, but it is not your destiny. And there are ways that you can turn off those through some of the other things that he's talked about today. Last one, and I think this is one that resonates so strongly with me because I see it in so many different places. I see it in my husband, my own self as I'm working on managing, my own life. Stress. You told
Yeah.
me that stress is a big one. Can you please expand on that?
So what I tell my patients, if I have to put one thing as the most important out of all these things that we've talked about, is managing your stress. I have never seen a cancer patient come into my office that isn't a highly stressed individual. Now, I
Mm,
do have some patients that come into my office that say, I'm not very stressed now, but guess what? They were stressed for 20 years. And if you're
mm.
stressed for that long time, for that long of a period of time, that stress is going to really increase your cancer risk. And let's talk about why this can increase your cancer risk. For one, this is going to drastically increase your sympathetic nervous system. Remember, we talked about sympathetic nervous system, increasing inflammatory cytokines when you eat sugar. But let's say you're stressed out all the time, you're going to be increasing that sympathetic nervous system, which is your fight or flight response, and that increases inflammatory cytokines. The more inflammatory cytokines that are always roaming in your body, it's going to cause damage to your body. And the more trauma that happens, the more potential there could be mutation of your cells and lead to cancer. Now, inflammation isn't bad, right? We need inflammation for us to be able to heal our knee if we hurt it, or we sprain our ankle, we need to heal it. But that's acute inflammation. But if we have constant inflammation in that ankle joint all the time, guess what? That's going to start destroying that ankle joint. So you want short-term inflammation to heal, but you don't want long-term inflammation. And when we are chronically stressed, we're going to have chronic inflammation all the time. Also, when we're stressed, we're going to be flooding our bodies with tons of sugar. Also, over time, we start suppressing our cortisol response. So when we flood our bodies with a ton of sugar, we're feeding these cancer cells, increasing inflammation, kind of putting uh, fire, put a fuel on the fire, so to speak, when we keep on doing this. Also, if we decrease our cortisol response, cortisol is what regulates our inflammation. So if you're messing with that, that's going to mess with things. But let's say you're flooding way too much cortisol, which is bad too, is you're going to be suppressing your immune system. And now it's not going to be able to fight off these cancer cells very well. Also, cancer can lead to all your systems not working well. And it's going to affect how your gut absorbs its nutrients. So then you're going to be nutrient deficient. And then your immune cells and other cells throughout your body aren't going to work well enough to be able to fight off the cancer cells. It's also going to affect your mitochondria. And a big potential theory on cancer is disruption of the mitochondria in the cells. And if you mess with that, that can lead to cancer. So that's just a quick rundown of what keeping your stress under control is so important for preventing your cancer risk.
You know what I'm hearing when you talk like this is when we think of cancer, we think biological condition that can only be treated biologically. And sure, cortisol and sympathetic nervous system, that's all biological elements of our body. But what influences that is our thinking and our feeling. And so it seems to me that part of the battle with cancer is not just focusing on the physical, but thinking about, really looking at our mental state, our emotional state, our spiritual state, and really looking at where do we need healing in that as well, because that could be putting fire on the biological issue that we're struggling with.
Yeah, thanks for bringing that up. I just want to bring it up is a big one too is try to work really hard on how you feel about yourself because that's huge too. A lot of the patients that come to me, they might look on the outside that they really have a high self-esteem, but really they don't love themselves. So that's a big thing too, is we need to work on doing whatever we can to start increasing our own self-esteem. Some people lose their self-esteem and think it's because that it's them. But any person on this planet can increase their self-esteem. You're usually getting a poor self-esteem from outside sources. And you need to look internally and get your own feelings about yourself from yourself and not other people. Because that's a huge thing is how you feel about yourself, how you think can really affect how your body heals.
It makes sense. I mean, if you hate yourself, then cancer hates you too, so
Yeah,
it's like
yeah.
it seems like that's just like it's just copying what you're thinking in a sense, and it's just you're telling your brain is kind of telling your body, I don't like myself, so do this to my body that, would hurt it. So
Mhm.
it's powerful. And I think the more that we're learning about science and just the combination of the mind, body, spirit, and how that all works together is just super powerful. So, all right, if you are listening to this and any of this resonates specifically with you, I'd love to hear in the comments. Give us this video a like. Let us know that you appreciate what we talked about today. Ask any questions in the comments, and we will make sure and answer those. But if anybody wants specifically to talk with Dr. Jake, to schedule a virtual appointment or anything like that, Dr. Jake, can you please remind them, how can they get a hold of you?
So yeah, look us up on the internet. Look for integrativemedica.com. Find our website, find our number out there, give us a call and set up an appointment with my receptionist. We do in-person and also virtual visits. So if you live somewhere else besides close by, we can always do a visit for you. We can set up a visit with me or some of my great other doctors we have at the clinic.
Wonderful. All right. Thank you so much, Dr. Jake, for this interview. And for everyone else, we'll see you next week.
Hey, Dr. Jake, thank you for your time today. And if you enjoyed the show, then do us a favor and leave a review. It helps more people to find the show, which could save their life. And remember, this is a podcast and should not replace personalized attention from a medical professional like Dr. Jake. If you or someone you know has been diagnosed with an autoimmune disorder, cancer of any stage, or a life-changing illness, visit our website today and schedule a virtual appointment with one of our doctors who can lead you to a treatment plan in your area. That's integrativemedica.com. Integrative, Medica.com.
Thank you for listening to the Integrative Medica podcast with Dr. Jake. To hear past episodes and get alerts for the future, subscribe to us on your favorite podcasting platform and be sure to follow us on YouTube as well. Just search for Integrative Medica with Dr. Jake.